Hey there, my name is Tobin Richardson, and I'm a clinician myself, as well as the provider education manager here at Sondermind. I've been part of developing training for those in the mental health field for a while now. And one of the things I've come to believe is that good training, which gives tangible skills to use with clients, is so valuable. But in the past has usually required me to sit in front of a computer screen, which is the last thing I want to do in between sessions or over a weekend. And as far as I'm concerned, it just doesn't have to be that way. And so we're trying something different here, which is to develop an audio series focused on different evidence based practices. So here's the first of these, which revolves around a character that is a perfect candidate for a type of therapy for those who have experienced trauma. And the specific practice the provider uses here is called prolonged exposure therapy, which is a type of therapy you've probably heard about before, but it has a lot of nuances and some distinct techniques that are really important to get right. And you'll learn about what those critical pieces are. So I'm going to cut over to Amy, who is the character that this story will focus on.
You should probably know a little about me before we get into all this. There's the stuff I'd say if this were my dating profile. I'm 29, I like to travel and hike. I have a dog named Sasha. She's named after Beyoncé's alter ego. But this isn't a dating profile. And as brutal as online dating is, I think what I'm doing here might be worse. This is my story, my history. I'm telling through an effort to heal. I'm almost 30, and I've been hoping my childhood trauma would just sort of fade away slowly with the passing of each year. But that hasn't happened. It's shifted, but it's still there. And I'm reminded of it in ways that still surprise me. Like the other day, when I was at the grocery store, talking on the phone to my friend, and I overheard this father and daughter walking in the aisle beside me fighting about something, and I totally, disassociated or something. I went silent and almost forgot where I was. And that, combined with 1,000 little other daily occurrences, drove me to this, to asking for help. I didn't want to say this, or more like I didn't even realize it consciously. But lately, I've begun to put together that all, or at least a lot, of my issues seem like they come from childhood me. I don't know, it feels like going to therapy will bring back that old version of me. The one I feel sorry for, I feel angry for, the one I wish I didn't have to think about at all. But the more I try to forget about her, the more I feel her pain. I feel her pain when I'm upset or tired, when I'm away from distractions, when I'm at the grocery store. A couple weeks ago, I finally got the courage to actually set up an appointment with a counselor I could meet with online. I'd literally probably been through these same motions a dozen times in the past. I'd tell myself I needed to reach out for help, but then I'd come up with some excuse for why I needed to do it later. I swore I'd actually go through with it this time. My therapist is named Josh, and his online profile said he used to work in a school. I'm not sure why, but I liked that. I was really nervous before signing on to meet with him. After some initial pleasantries, he asked me what I wanted to work on, and I suddenly became very aware of my heart beating in my chest.
How are you doing today?
Hey, here's some of our first session. Nice to meet you. I'm Amy.
So now I want to get into a little bit about why you decided to come in today. Like I said, I did have a chance to look at some of your paperwork. So I feel like
why I decided to come in.
Kind of a background idea.
I wish there was a box I could check to answer that question. Anxiety, I guess, or I'm just neurotic or obsessive. I don't know. But over the last few years, I've come to the painful conclusion that none of this is going to go away on its own. I've always thought a lot of this stems from the way I was treated by my mom. Or, I guess, more by Ron, my mom's husband. My mom was beautiful and sweet, but lost. My dad left her when I was 5. I like to think that before that, she was okay. But then, once he left, she became obsessed with getting remarried. She ended up meeting Ron, who later became my stepdad, at a chance encounter at the park. He started talking about how he pastored at a local church. I think she liked that. And he invited my mom, and it seemed like this whirlwind. They were married a few months later, and immediately I realized my life was going to be different. He was more cult leader than pastor, and his life purpose seemed to be to control first my mom, and then later me. But I can't bring myself to say all this to Josh just yet. So I say this instead.
I'd really like to hear from you exactly what you think I can help with.
Yeah, so I think really what brings me in is I've just been having a lot of anxiety. That's not really new for me, but it's gotten to the point where I just really want to work on it. I don't want to live like this forever if I can find a way around it.
Well, thanks for sharing all that. It's really helpful for me to just get a background on some of these things that you've been dealing with, and me putting some ideas together. Something that sparked something in my mind is you mentioned that you have been taking different ways to work. I'd like to dive into that a little bit deeper. Do you mind sharing a little bit more about that?
Yeah, I just really don't like taking the highway to work. I don't like doing that. The highway, the distractions. As you could probably guess, there's more to that story. Highway 24, the one that's my only real option to get to and from work, it's littered with billboards. Fast food, parks. But there's this one billboard, if I'm being honest, that's really central to my entire predicament with Highway 24. It's this billboard for Westmont whiskey. And it features this woman who, to me, looks more like a girl. Probably this 19 or 20-year-old person who's dressed in literally the shortest jean shorts I've seen in my entire life and a bikini top. And she's holding the shot glass and smiling. And I can't explain it, but I just feel so bad for her. Like thousands and thousands of people drive by every day just staring at her body. And I just can't help but feel like she couldn't have wanted that. She couldn't have possibly expected it. And it feels so wrong. When the billboard first went up, probably last winter, I'm not sure I even saw it at first. But one day, I did notice it, and over the next few, weeks or months, I started to feel this overwhelming feeling of gloom every single time I drove by. I couldn't not see it. Eventually, I just stopped taking the highway altogether. Instead, I'd weave around the back roads the entire way. As I reluctantly describe this to Josh, I can't tell what he's thinking. I find myself hoping he gets it. Why the billboard seems so unfair, so wrong. Although I've never talked with anyone about why I take the long way to work, I've got to admit, it feels good to explain it out loud. During the span of the first few sessions, Josh asked a lot of questions about the billboard and just my experiences in general. I was impressed by how thoughtful and inquisitive he was, and found myself letting down a guard I didn't even know I had up. I've spent so long trying to forget about my past that it felt instinctual, ingrained, just to skim over the details, or avoid talking about my childhood altogether. If anyone asked me about my childhood, it was just easier to tell myself they don't really care. They don't really want the whole sob story. It's session 3 now, and Josh mentioned at the end of the last session that he wanted to talk through some options for our work together going forward.
We've certainly covered some stuff the past few weeks. I don't know about you, but you may be a little bit surprised at all the stuff that we've been able to talk about.
Yeah, I don't think I knew what to expect really, but yeah, we've gotten into it.
Yeah, we sure have. I've been thinking about our situation and thinking of some things that might be helpful for us to talk about.
Okay.
And given kind of what you shared with me about your childhood, along with just kind of your issues that you're having with stress and anxiety throughout the day, I'm curious if there might be some trauma from your childhood that we haven't been able to process, or you haven't been able to process in your own.
Yeah, I could see that.
So something that has been helpful in the past, and I'll talk to you a little bit about it.
As Josh and I have moved through our early sessions, he's brought up a treatment he thinks we could consider called prolonged exposure therapy. He said it's a practice that studies have shown can be effective in helping to alleviate ongoing symptoms of trauma. Thinking about my past experiences as trauma gives me mixed feelings. Partially, I agree because I know how painful it was and it still has such a hold over the way I am today. But the other part of me feels like, I don't know, a little dramatic, framing my childhood in that way. I wasn't in a war, I wasn't even hit. At some point, I guess I agree with Josh. I did experience trauma, so a trauma treatment sounds fitting. Josh talked a lot about what prolonged exposure therapy would entail. Facing my trauma head on, talking about it very directly, exposing myself to things I've been avoiding. I get it. I get why it's important. Doesn't mean I want to do it, but I also want things to change. He talked a lot about how it will be my choice if I want to do this or not, but it's my decision, not his. I think I want to do it. I think it's time.
Coming up next, you're going to hear Josh and Amy start the work of prolonged exposure therapy, highlighting some of the big and essential techniques. You'll hear a little about the PCL5, which is an assessment tool that's often used in trauma work, as well as about how to provide psychoeducation, so the client knows what to expect and has all the information they need in order to make a decision about if they're willing to participate. You'll also hear how Josh teaches breathing retraining, which is simple but so incredibly important before any trauma exposure exercise. And then you're going to hear what I think of as the meat and potatoes of prolonged exposure work, which are the exposure techniques themselves. You'll hear an imaginal exposure exercise, which happens within the session, and about a form of in vivo exposure, which in this case happens through outside homework. All right, back to Josh and Amy.
I've been thinking, and there is this tool that I use sometimes with dealing with similar situations and kind of some stuff that we talked about that can sometimes be helpful. It's a pretty brief questionnaire. 20 questions. Questions are on a 5-point scale.
As we started our second session, Josh asked me to fill out a questionnaire called the PCL5. It's pretty short and measures my symptoms of PTSD. He mentioned this is something we'll keep using in order to check in on how I'm doing. Josh explained that sometimes, especially when people decide to try and work through past trauma, it can be really challenging. Sometimes things even get worse before they get better. And the PCL5 will give us an objective measure to be able to use each week to gauge where my symptoms are at. Josh knows I'm nervous about talking about my past experiences, so he's also asked that we practice deep breathing. He says it's a tool I want to have available if my anxiety starts to bubble up.
But doing some deep breathing is one of the best ways that we can take care of ourselves and keep ourselves calm in stressful situations. And just to give you a little bit of a background about like why it's helpful, deep breathing is one of the only ways that we can physiologically calm our bodies, and that's usually done by slowing our heart rate. So when we take very deep, slow breaths, it kind of, as we talked about earlier, our mind can be really helpful, but it can also, get us in trouble sometimes. Taking those long, deep breaths, it kind of tricks our mind into making us feel that we're calm. But you're essentially you're counting your breaths using sequences of 4. So the way it works is that you take a big, deep breath in through your nose, and while you're doing that, you count for 4 seconds. And then once
in session, we actually practice this together. Breathing in,
for 4 seconds, and
breathing out.
After that's up, then you'll exhale slowly and controlled for 4 seconds. And then at the very end, you will hold, once all the air is out of your lungs, you'll hold that for 4 seconds.
Josh and I are meeting for our 4th session today. It's interesting to think about how nervous I was for the first session. Now, already, I feel like he gets my struggle. I trust him. After talking through the billboard, we moved on to other topics. My work, my relationships, my childhood, and that last topic, it stirred up a lot of questions. I told Josh about my relationship with my mom and Ron. As soon as I started talking about how brutal it all was, I started to get choked up. Josh asked a lot of probing questions, some of which were really painful to answer, and I think we both started to realize how impactful it was for me to be treated in that way. All the name calling, all the lies and the hypocrisy, the way I had to wear pants and long sleeves year-round because, according to Ron, showing skin was ungodly. How I pretended for an entire spring to be running on my middle school track team just so I wouldn't have to go home after school and constantly be belittled. The time Ron saw a picture of me online with a centimeter of my stomach showing and with a beet red face screamed at me for what seemed like hours about how much shame I brought to our family. Session 5. I know what's coming today. Josh and I have talked about how processing trauma in the right environment can actually help alleviate the lingering symptoms associated with it. The symptoms that otherwise can show themselves in really disruptive ways, sometimes even decades after the trauma took place. He's asked me to consider participating in an exercise called imaginal exposure. As we discussed this, we landed on talking through a painful fight I had with my mom and Ron. It's the one that led to me moving out of the house at 17 with nowhere to go, crashing on couches and roaming the streets for the months afterwards, praying for a call saying she'd left him. It's the fight that led to my decision to get as far away as I could, leaving my school and my friends and my neighborhood all behind. Josh explained he'd like me to talk about this in a specific way, with my eyes closed and using first-person language, like I'm back in that moment. Saying I feel rather than I felt, to narrate what's happening in as much detail as possible as if I'm watching it happen live, right now, right in front of me. Even the thought of talking through all this makes my skin crawl. I'm trying to remember I'll be safe.
So
I can do this.
I think we're getting to a good point where I think you're ready. I think you're ready for us to dig into that exercise that we've been talking about. So just as a brief reminder before we get going, first and foremost, it's all about your comfort level. You know, I want to make sure that you're feeling ready for this. Like I said, I think we put a lot of work in and you've been doing a phenomenal job. So I think you are ready for this. But just as we're going through this, remember those breathing techniques that we've talked about. Also keep in mind, you know, I'm here as well. So this is a safe place. I only want you to go as deep as you feel like you can, but you really have put in the work recently, and I think you've been doing an excellent job building up to this. And so I'm also going to do my best not to interrupt. You mentioned there was this really intense argument or fight. I can't remember exactly the words you used for that, but there was this really intense situation that occurred with you and your stepfather. And I think it could be helpful for us to go into that. So what do you think? Do you think that this is something that you're ready for?
Yeah, I'm nervous, but I think I'm ready. Okay, yeah, so I have been out with some friends. We were just hanging out at the local park, and I walk in through the front door, and I can tell that my stepdad is, I don't know, agitated. He's not happy about something. And I just kind of pause. I don't know what's going on, so I start to be like, hey, just, greet him like I normally do. And he starts to ask me, where have you been? What are you doing? Who were you with? And, I tell him, but at this time, he's really strict about like what I wear around my friends. And usually what I do is I pack a little bag and I change when I get to the park because I want to look like the rest of my friends. Like I want to wear what everyone else is wearing, and he doesn't like that. And so I change when I'm there, and then I change and I drop my bag off like on the way home. And I can just tell something's weird. Like, he's asking me a lot of questions. He usually doesn't ask me that many questions. And so I just kind of try to go on. Like, I try to go to my room, and he starts to just keep bothering me, basically, like ask me questions and bother me. And he ends up telling me that he saw a picture of me online and he knew it was today and I wasn't wearing what I have on when I came in the door.
You're doing great.
And I can just tell he's getting furious. Like, he's realized all at once that I'd been changing my clothes, that I'd been lying to him. And he starts like screaming, really screaming, to the point I'm scared and my heart is racing and it feels like a dream or something. I'd seen him scream at my mom, but never like this. Never this type of rage. And he's screaming about how, I don't know, I'm shameful, I'm dirty. He starts calling me like a demon and a whore. And I'd heard him use those terms, but I was shocked. Like, I already hated him, but hearing him call me those things, it felt so wrong. And my mom, she's there. She's over in the kitchen. This whole time, she'd been making dinner and like pretending that she wasn't seeing this happen 10 feet away. And I'm looking over at her, wondering if she's going to do something. Because I know she never confronts him. She never questions him. Never. But if she's going to, it's going to be now. He's calling her daughter a whore, you know? An inch from my face. And for a split second, I see her look up at me. And we see each other. And the look in her eyes, it's so sad. It's defeated. She's given up. And in that moment, I know she's choosing him. Like, this is it. For so long, I thought she'd see him. See he was a fraud, a liar. But like, in this one moment, I realize she does see it. And she just doesn't care. And it's like I feel my heart breaking. In the middle of the chaos, looking at her, I feel it snap. And I know right now, I know I'm going to have to leave. Leave for good. And I'm going to have to leave her there and save myself, even though I couldn't save her. I have to leave her behind. I never expected to tell that story. All these years later, and I realize I never have. I left our session that day feeling exhausted, totally drained. But a few days later, after some sleep and reflection, I was glad I did, that I was able to do it. It felt like a relief. Josh assured me we'll be able to take a break before doing any other imaginal exposure exercises, if we decide to do any more at all. He says there are other types of exposures where, even outside of our sessions, I can do things that I've been avoiding. Things that aren't dangerous, but are just almost like side effects of trauma. Things my brain has associated with the event, so it now causes me anxiety even though it shouldn't. I have an idea where he's going with this. He tells me this is another part of prolonged exposure, and this technique is called in vivo exposure. He explained that sometimes in vivo exposure happens within a session, by doing things like looking at pictures that are connected to the after effects of trauma, things that have been avoided even though they don't need to be. And then eventually this exposure helps them to seem less scary, less radioactive, until hopefully they ultimately don't have much of an effect at all. But for me, he wants me to actually do this outside of the session as homework. He explained how even outside of the session, this homework can follow the same type of progression. If the negative side effects, the anxiety or the panic, wear off over time, we can slowly make the homework more challenging until I'm no longer avoiding the things I once was. Back to the session.
Hey, welcome back. Good to see you. How are you feeling today?
Actually, really good. I think I've been doing a lot better. I didn't wake up in the night at all last week, which, I used to do every night. So I think I'm doing a lot better.
That's amazing. I mean, that's
Yeah.
huge growth. That's wonderful. And I've been I've been picking up a little bit from our meetings, and it seems like you are making a lot of progress, and it's really good to hear. Like that's true at home as well.
Yeah,
So
thank you.
that's awesome. Yes, I want to bring something up that I think might be helpful to try. Just kind of building off that positive momentum that you've already been able to develop, and just knowing that like you can put things into action and it actually does help, and you can do it. You've showed a lot of courage throughout this whole process, and I'm asking you to continue that and try something that might seem a little bit scary, but I know that you can do it. So I really hate for you to have to, you know, take twice as long to get to work by avoiding that Highway 24 that has that billboard that we've talked about. I'm curious if, in the spirit of continuing to push ourselves out of our comfort zone a little bit, knowing the positive gains that can come from that, if you might feel comfortable, let's say, getting up earlier than you usually do to avoid some of that rush hour traffic in the morning and taking Highway 24 to work. I'm not saying that you need to be staring at that billboard. I don't think we're necessarily ready for yet. It's just also not a safe thing to do while you're driving a car. And I encourage you to use your breathing strategies when you get to that point when you know your anxiety is going to be coming up. And just kind of seeing once you do that, how you feel. Do you think that is something that you might be able to work towards?
Yeah, I guess I can probably do that. One small step. Just one at a time. Thinking back to the beginning of this, that's the way it's been, and the way it'll still be. I know there are a lot of steps in front of me, but I feel like this process, these tools, and the system, I can see why it works. Because it's structured, but it's still flexible. And it gives me tools like deep breathing and metrics like the PCL5 scores, which help make it feel like improvement is possible. It's all working towards something, one step at a time. Maybe right now they're baby steps on the sidewalk, but someday they'll be on the highway.
Up next, I'll be talking to a Sondermind provider practicing in Arizona named Mark Conway. Mark is an active Sondermind provider who specializes in trauma work with just tons of experience and insight into how to do this work well. You'll hear a little from Mark and I's conversation about his advice on the best practices for implementing prolonged exposure into our work here at Sondermind. Hey, Mark, how are you?
Doing great, Tobin. How are you?
I'm good. Well, thank you so much for joining. Super excited to hear a little bit from you about your trauma expertise. I was wondering if kicking off here, you could just tell me a little bit about yourself.
Yeah, absolutely. So I've been working in the field for going on, I want to say, 10 to 12 years now. I started working with survivors and perpetrators of domestic violence. From there, I went to work with the severely mentally ill. And then, most recently, before Sondermine, I was working with people getting out of prison and rehabilitating back into the community. So, I think that as far as my interest in trauma goes, it really starts from the very beginning. I have been around that piece of the process, in every stage of the work that I've been doing. And I find that it is just hugely impactful in people's lives and the way that they handle things and approach situations. And so my interest in it has really been focused around trying to find ways to work with people who have gone through these really difficult experiences and helping them to get to a place where they're living the kind of life that they want to rather than one that they feel trapped in.
How do you navigate when it's appropriate to really consider trauma and exposure exercises with a individual client?
Well, I think the very first thing that I try to keep in mind is what is trauma to that person, right? Because I think that, as clinicians, we have a very clear academic understanding of what that experience is. There's a lot of theoretical information that we're constantly absorbing about these ideas and what it's like and how to get through them. But at the end of the day, what we're dealing with is a human going through a human experience, right? And so I try to keep that in mind as much as possible when I'm working with and interacting people around this sort of thing. Because what we're really talking about when we're talking about dealing or working with trauma in any capacity is taking someone who has been avoiding a specific topic or issue for most of their life or for a significant portion of it and really sitting them down and helping them face that trauma in the greatest extent possible so that way it's no longer kind of dragging them down, right? That entire process right there is painful and there's really no way around it. It sucks, right? So I think that it's really critical that before I begin any trauma work with a person, that we really start making sure that they're capable of handling that level of emotional intensity and discomfort. One of the things that I like to incorporate as kind of a tool for the assessment process is time. When I'm working with somebody and talking with them about like their daily life and how they're handling things, I can get a better idea of what's really going on and how they're coping and managing themselves, right? So if I ask somebody flat out, like, "Hey, how are your coping skills? How would you rate them?" So on and so forth, that assessment from them tends to be very questionable in its accuracy because people don't really think about things in those terms. And so that's a muscle that they really need to learn how to flex in the first place to really get tuned in. So when I'm just asking that off the cuff, the chances of them really knowing how well they handle discomfort and distress are pretty poor.
So it sounds like for you, that may take several sessions for you to really feel like you're comfortable
Mhm.
assessing the appropriateness of using something like an exposure exercise
Yeah.
in session. Yeah.
So typically what I'll do is I'll start with a lot of education because I think that that is a really critical component of the work that we're doing here. In my opinion, really good trauma work starts or is like 80% setup and 20% execution. Right. And what I mean by that is that time that you're taking to really prepare the person for the work they're going to do is what I think makes or breaks their actual experience in dealing with the trauma. Right. Because again, we're dealing with really fine tolerances here. If I'm taking somebody into dealing or working through trauma, and they're not, engaged enough, then we're not actually doing anything. We're just kind of going over old wounds without receiving any sort of real benefit, right? If they're too far into it or if they're too emotionally escalated, then I'm re-traumatizing them and causing further problems down the line. So because we have to hit such a fine target, that's why I think that prep work is really where the real trauma work is being done. I'm a very big believer that people have the ability to work around trauma and it does not always need to be addressed because there's plenty of people in this world who never go through any sort of trauma treatment and are able to live lives that are relatively high quality. So if they are not ready, they are not willing, they don't want to, then that's okay. At that point, we just end that piece of the conversation. But we're very aware of, like, if we continue, hey, these things that we're talking about that you're stressing out about are connected to this. So if we want to really get down to getting this taken care of, we're going to have to come back to this trauma treatment. And keeping them aware of that, I think, helps them to kind of acclimate to the idea of it. And in my experience, it only takes a couple of sessions before people are warmed up to the idea and finally feel like they have enough faith in themselves to be able to go through the process.
What about once you get agreement, so you get client buy-in, you start the exposure work. Then once the exposure happens, either you worry or the client worries that it is too intense. How do you navigate that situation? Or does that just not really happen?
So what I do with people as part of the prep work is we create a lot of signs and signals that we're reaching that threshold where it's too much. Things that are red flags or indications that we're going too far. So that way we can stop it before it gets there.
Let's assume it's that you've made the decision on the client that trauma exposure exercise is something that you're going to try.
hmm
Can you walk us through what it usually looks like for you in that session where this is going to happen?
So at the very beginning, we kind of established that that's what's going to happen today. We, touch base. I make sure that they're in a good place, that they don't have anything that's going to be distracting or, something that's going to pull their attention away. We start by centering, getting focused, doing a little bit of deep breathing, meditative work, and then we talk about what's going to happen. And I think that that's a really critical piece of the puzzle because just going into it, I think, can be a little too much for people. So I really focus on kind of summarizing what they're going to go through, what it's going to look like, and then we begin the process. We'll spend the bulk of the session on the actual exposure process.
Do you find that your clients are more likely to engage in the trauma exposure exercise in session versus giving them homework out of session, or vice versa, or no difference?
I think that it really depends on the person, but typically speaking, I find that people are much more willing to do the work in session than out of session. Because again, at this stage, we've developed a rapport, we've created a sense of trust, and we've created therapy as a place of safety for them to experience those things in as a least threatening way as possible. Right. And so, in my experience, most people are on board with that in session, and then it's out of session where they really struggle with, following through.
Got it. How often would you say at Sondermind you've had clients who presented with a different presenting issue, depression, anxiety, relationship issues, where then over time you realize that like a trauma treatment might be useful?
Well, I think that people come in with other symptoms that end up being trauma related all the time. You know, I think that this is something that at least in, the American culture, we're still working on developing language around and providing space to. There's a lot of stigma that still comes with mental health, although that has been waning over the years and getting better. So, recently I've seen a huge increase, for example, in my male clients, which is something that historically, it is a demographic that would avoid therapy. And we've actually been seeing more and more of those clients, which I think is really powerful and positive. But most of the time, when I'm talking to people who are coming to me with like depression or anxiety, there is some trauma kind of lingering in the background there that's connected to the process. A lot of people have this tendency, in my experience, to undermine their own experiences where they see others people experiences as true trauma and their own as not. Right, they'll say like, oh yeah, I know that my dad beat me all the time, but like at least he didn't like stab me, or at least he didn't force me to do drugs. Right, like that's what I heard this guy went through, so his situation was way more traumatic. Mine wasn't really that big of a deal.
Um, what else do you think is important for providers at Sondermind to know or think through before doing prolonged exposure?
So I think the biggest thing is you kind of touched on it in the very beginning, but I think that trauma work itself can feel very intimidating, right? We're talking about, exposing people to the things that they have been trying to avoid dealing with for, a significant portion of their life. We're talking about walking with them through the process of extreme personal agony. Part of trauma treatment means that you're sitting there listening to these horrible stories that happen to people in these awful ways and having to hold space for them to be able to go through and relive the worst moments in their life, sometimes over and over again, right? And I think that because of these factors, it can be really hard to feel comfortable enough to really approach this kind of work and to really have the confidence to be able to jump into this sort of thing. So I think that for anybody who's interested in learning more about this and working on those skills, I think it's very valuable to be able to go through formalized workshops or training regimens, because it allows you that opportunity to get more familiar with the ideas and the experiences in a way that's safe for you as a therapist before you start working with clients where that confidence may get shook or challenged, right? Because I think that at any point when you're doing trauma treatment, at some point you're going to do something wrong. You're going to make a mistake. You're going to make a bad call, and if you don't feel like you have the confidence in your abilities as a therapist to recover from that, it can be extremely intimidating to try to tackle these sort of issues.
Anything else you can think of that you think would be important that we didn't get to for Sondermind clinicians to know about trauma work?
I think that just remembering that recovery is not a straight line. I think that it's easy when you're following a clinical manual to feel like, it's going to go from step A to step B to step C, and everything's going to progress in this very smooth way. But I think in real life, in the actual application of the theory, what we see is that those extenuating life circumstances often have an impact on people's progress. So there may be times where you feel like you should be at step C, but you have to go back to step A because of whatever else is going on in that person's life, and kind of restarting that process and just being willing for that to happen and okay with it. I think that if you get too caught up in the outcome and focused on, well, I want to be a good therapist, they have to be making progress, it can really make you lose sight of staying where the client's at rather than where you feel like they should be.
Awesome. Well, thank you so much, Mark. It's amazing to get to hear, to be able to share your expertise and insight on this topic with our Sondermind provider community. So I really can't thank you enough for your time.
Well, thank you, Tobin. I really enjoyed this and hope I get to do more of it in the future.
A special thank you to Mark and all those who lent their voices and insight into creating this resource for our Sondermind community. As developing and delivering content in this way is a brand new initiative, I'm asking for a favor. Please take a brief evaluation we'll be linking here within Sondermind University to help us better understand the impact of this type of audio training. We need to know from you if this is a type of delivery that works. If you have any questions or concerns, either about prolonged exposure or about provider education in general, you can always reach out to myself, Tobin, at trichardson@sondermind.com. Until next time.